So let's continue to talk of Patrick Couvreur. He is probably one of the persons who was here at the first iteration of the Pre-Am conference, and he has been a frequent visitor and a frequent speaker here, and we are looking forward to hear from you your newest findings. You're from France, Paris, Orsay. The floor is yours.
Thank you very much, Patrick. This is a microphone. Okay, thank you very much for your kind presentation. It's really my pleasure to be invited by Beat to deliver this talk on novel nanotherapies for inflammation and pain. So first of all, I would like to just, as you know very well, to remember that the encapsulation in current nanocarriers, including liposomes, polymer nanoparticles, polymer micelles, etc., results rather from physical encapsulation processes. This means, of course, encapsulation, adsorption, entrapment, etc., etc. And this results in two important limitations. The first all is that you have a poor drug loading if you are looking to the percent of the drug versus the transporter material. And the second limitation is the so-called uncontrolled burst release, which is due, you know there, to this fraction of the drug which is rather adsorbed at the surface of the nanocarrier of the nanotechnology than really encapsulated into its core. And to overcome those problems, we recently decided to move from the physical to the chemical encapsulation paradigm. In other words, to do chemistry instead of physics. And to do that, we use the squalene. Why? Because it is a natural lipid, which is, as you know, biocompatible. We have all squalene in our body. It is a precursor of the biosynthesis of the cholesterol. And as you can see here on this cartoon, this natural lipid adopt, in fact, a molecular folded conformation in water. And in fact, we are taking advantage of this compact molecular conformation of the squalene, as you can see here in the bottom, to link the squalene used as a transporter molecule to several drugs through a biocleavable linker. And amazingly, we have observed that after putting those bioconjugates, those prodrugs into water, well, you get, by supramolecular chemistry and a spontaneous self-assembly as nanoparticles with a size in between a few 10 to a few 100 nanometers, and with a much higher drug loading than after the physical encapsulation processes. Why? Just because, as you see, each molecule of the squalene will be able to transport at least one molecule of the drug. And also, because you have a chemical link between the squalene in red and the drug in green, of course you have an absence of burst uncontrolled release of the drug. And also, if you are a good chemist, you can design a biocleavable linker which will respond to an endogenous stimulus and which will allow the specific leakage, liberation, release of the drug into the target cells or tissues or even subcellular compartments. And I would like to show you today that there is a very interesting application of this technology in pain alleviation just by targeting the inflammatory, painful tissue. In fact, you know that the treatment of pain is represents a major medical challenge because the morphine derivatives, the opioid derivatives are inducing very rapidly tolerance and then dependence and addiction. And this is a major problem in Europe, but also in the US. Just to give you an idea, there are 11 million of patients in the US who are addicted to treatment with opioid derivatives or morphine. So one interesting option is to use those neuropeptides like endorphin, like enkephalin, which are not inducing tolerance and addiction because they are playing on delta receptors and not on mu receptors. But unfortunately, it is not really working. Why? Because those molecules, those endogenous neuropeptides, are very rapidly metabolized after administration with a half-life, as you can see here, of a few seconds. And to overcome this problem, we have synthesized, as you can see here, a small library of leuenkephalin squalane bioconjugates with a deoxycarbonyl linker, with a diglycolic linker or an amide linker to be able to control the release of the neuropeptides. And interestingly, if you are putting those bioconjugates into water, you can see that you get nice nanoparticles by supramolecular chemistry with a size in between 70 to 120 nanometers. And if you are putting those nanoparticles in a biological medium, in serum, for instance, you can see in black that the prodrug, the bioconjugate, will disappear, and in orange will release the intact peptide. Then we have tested, of course, the efficacy of those leuenkephalin squalane nanoparticles for pain alleviation. And we have used a model of painful inflammatory pain by injecting carrageenan, as you can see there, in the right paw of rats. And we will measure, by using the Hargreaves test, it was already mentioned, the paw withdrawal latency by illuminating, in fact, a laser light at the level of the painful paw. Look what happened with morphine. Up. First of all, if you are taking a normal paw, before to treat the animal with morphine, you have a paw withdrawal latency in between 6 and 8 seconds. Then you are injecting the carrageenan. You can see that there is a decrease in the paw withdrawal latency because the paw is becoming very, very painful. Then, if you are injecting morphine in blue, you can see that there is a huge increase of the paw withdrawal latency, but it is too high. It is much higher than the normal sensitivity of a healthy paw. And you can see that the analgesic effect is decreasing very, very rapidly. Now, interestingly, you know that naloxone is an antagonist of morphine. So if you are injecting naloxone also, you can see that you will, in red, completely abolish the antinociceptive effect of morphine because naloxone is able to pass through the blood-brain barrier. Now, interestingly, if you are taking the naloxone metiodite, which is also an antagonist but not passing through the blood-brain barrier, you can see in green that you don't abolish the analgesic effect of morphine. And this is a clear demonstration, of course, that morphine is acting through a central analgesic effect responsible, of course, for the tolerance and the addiction. Now look behind what happened with the nanoparticles of leuenkephalin squalane with a diglycolic linker. First, in blue, you can see that you have a long-lasting analgesic effect with an area under the curve which is higher than with a normal dose of morphine. And of course, in black, if you are administering the neuropeptide as a free drug, you have no pain alleviation. But interestingly, if you are injecting naloxone metiodite before the nanoparticles, I remember that the naloxone metiodite don't pass through the blood-brain barrier. You can see very clearly that you completely abolish the antinociceptive effect of those nanoparticles, contrary to what happened with morphine. And this is a clear demonstration that those nanoparticles, because they don't pass through the blood-brain barrier, are acting peripherically for pain alleviation. And in fact, we observed almost the same profile with those nanoparticles with an amide linker or those leuenkephalin squalane nanoparticles with a deoxycarbonyl linker. Then we investigated the mechanism behind that in terms of biodistribution. And to do that, we have labeled our nanoparticles of leuenkephalin squalane with a fluorescent dye. And you can see very clearly that after intravenous administration, over the time, those nanoparticles will concentrate in the painful inflammatory area of the right paw. You can see on this magnification in red the concentration of the nanoparticles in the right paw. And you can use the left heel tip paw as a control, and you see that there are no access there for the nanoparticles. And this is due to the fact, of course, as you know very well, that at the level of the painful inflammatory paw, the painful inflammatory process, you have a leaky vasculature which allows the nanoparticles to extravasate into this painful tissue. And if you are doing also the whole body biodistribution, and you can see that also by imaging, you can see that there is no access of those leuencephalin squalene nanoparticles into the brain. And this explains to you why we have a pain alleviation, significant pain alleviation, but without addiction, like with opioid derivatives or morphine. Now, by following the same way of reasoning, and because of the COVID disease, I would like to show you that by using the same technology, it is possible to design multi-drug nanoparticles for the treatment of the paradoxical inflammation. You know that in the severe COVID, mainly 3 organs are involved with an uncontrolled inflammation associated with a cytokine storm. It is the pulmonary tissue, the kidney, and also the liver. And in fact, you know, the process is very problematic because, first of all, you have an inflammatory process which will induce an activation of the lymphocytes, the neutrophil, and those cells will extravasate into the tissue. And there you will have a liberation of cytokine or of chymokine with some reactive oxygen species inducing an oxidative stress. And in fact, this oxidative stress will still enhance the paradoxical inflammatory process. And so we decided here, as you can see here, to use the same squalenolation technology, but to do multi-drug nanoparticles, combining from one side adenosine up. Why? Because adenosine is acting on the adenosine A2A receptors, which are inducing an anti-inflammatory process, pathway into the cell, and also with vitamin E, just to have an antioxidant compound and to fight against the oxidative stress. So this is, in fact, the way we performed the design of those nanoparticles. First, adenosine. You know that adenosine is the same problem, still worse than the neuropeptide, because this molecule is very, very rapidly metabolized. The half-life is only 10 seconds after administration. And this is due, you see the arrow, to the deamination into inosine of the amino group. And so we have linked the squalene in green through the squalenic acid with the amino group of adenosine, just to protect adenosine from the metabolization. And by putting those adenosine squalene into water, we get also, again, by supramolecular chemistry, nanoparticles with a spherical shape. And those nanoparticles are very lipophilic. So it is very easy to dissolve the vitamin E into the core of those adenosine squalene nanoparticles. You can see that the size is around 60 to 70 nanometers with a negative zeta potential. And then, as you can see here, we used an endotoxemia model after lipopolysaccharide challenge to mice. And in fact, in this model, 3 major organs have a very strong inflammatory process: the liver, the kidneys, and the spleen. And you can see very well that after intravenous administration of those multi-drug adenosine squalene vitamin E nanoparticles, they concentrate, because of the inflammatory process, into the liver, the lungs, and also the kidneys. And you can see in the next slides, up it is for the lung, in the middle for the kidney. Sorry, I have no pointer. And below the liver, we were looking for the pro-inflammatory cytokine, MCP1 and IL-6 into those tissues. And you can see very clearly here in blue that the multidrug nanoparticles were decreasing importantly the level of the pro-inflammatory cytokine in those inflamed tissues comparatively to the controls. The controls are, of course, the untreated animals, the only squalene adenosine nanoparticles, the only vitamin E squalene nanoparticles, and the cocktail of the free drugs, adenosine and vitamin E. Then, if you are looking to TNF-alpha on the left up, you can see it is also, as you know, a pro-inflammatory cytokine. And you can see very clearly that by using the multidrug nanoparticles, you also decrease this pro-inflammatory cytokine. And very interestingly now, if you are looking to IL-10 after treatment with the multidrug nanoparticles, you have an increase of the expression of IL-10 comparatively to all the other controls, but IL-10, as you know, is an anti-inflammatory cytokine. So you can see that the cartoon is showing, in fact, that we have, with those multidrug nanoparticles, a diminished inflammatory process. And you can see very clearly on those histological slides that we have a control of the inflammatory process by using the adenosine squalene vitamin E nanoparticles treated animals, but that with the control in red you have a lot of inflammatory process which disappeared after treatment with the nanoparticles. So what is the result of that? First of all, up right, we have a much better sepsis, murine sepsis score, clinical score. This clinical score takes into consider the appearance of the animals, their activity, the response to a given stimulus, the respiration rate, etc., etc. And you can see very clearly in blue that we have a very good clinical score. Now, if you are treating in green the animals with the cocktail of the free drugs, adenosine and vitamin E alone, a single molecule, you can see that it is worse, and of course still worse, the untreated animals. And the result of that, you can see that below on the bottom, looking to the percentage of the survival of the animals, you can see in blue that 100% of the animals survive to the, after the treatment with the multidrug nanoparticles to the septic shock. By using the cocktail of the free drugs as single molecules, you can see that only 60% of the animals survived and only 40% after no treatment was performed. And if you are looking on the top left to the level of the peroxidation into the lungs tissue, you can see once again, and this is significant, that with the multidrug nanoparticles, you decrease the peroxidation at the level of the pulmonary tissue. So I hope that I have convinced you that by using this type of technology, the so-called squalenolation technology, you can, of course, protect the drug from demetabolization. This was true for adenosine. This was true also with this neuropeptide L-enkephalin. You can target, of course, the inflammatory area because of the leaky vasculature, a sort of up-here effect. You can release the drug at the right place, especially if you are playing on the chemical link between the drug and the squalene as a transporter material, and you can be also a multidrug. So I would like to close my talk by acknowledgement of all the people of my group who collaborated more or less to this squalenolation technology also with other application. And also a big thanks to the ERC because through 2 grants, I was able to develop this concept to use squalene as a transporter for many drugs. And I thank you very much for your attention.